So welcome in this video. Today we are going to discuss about the lumbar flexus, and in this video we are basically discuss about like how the lumbar flexus is originated and what are the main branches of the lumbar flexus and how does it occur. So lumbar flexus is generally formed from the anterior rami of the lumbar spine, that is L1, L2, L3 and L4. But before going to start to draw the lumbar flexus, I would like to mention one of the most important structures, which one is the psoas major muscles. In relation of these muscles, we will talk about the origin of a main branches of a lumbar flexus. So let's start to draw the lumbar flexus. So generally I already mentioned like the lumbar flexus is originated from the L1, L2, L3 and L4. So this one is the L1, L2, L3, L4, and I also draw L5, and here we can see the T12 also. So these all are the lumbar spine and through which the anterior rami is originated of this spine. So this one is the anterior rami of the L1, L2, L3 and L4. So from here L1 there are two branches. This one is the upper large branches and this one is the lower small branches. So this one is the upper large branches, which one is divided into two branches, or like it's give rise a one, and this one is the second. So this one is the first and this one is the second. So here we can see the L1, anterior rami of the L1 give rise two branches, that was the first and this one is the second. So first is a iliohypogastric, we can say this one is the iliohypogastric, and the another one is ilioinguinal, and L1 is also receive some fiber from a T12 and to give rise iliohypogastric, and then after one is ilioinguinal. So how can we remember, or how can we know like which one is the iliohypogastric and which one is the ilioinguinal? So the first branch is iliohypogastric and then second one is the ilioinguinal. Here we can see the H is always come before I. So here we can also remember through the H and I. The first one is the iliohypogastric and second is ilioinguinal. So from T12 the subcostal nerve, subcostals, is originated from the T12, and here the small branches, which one is received some fiber from the L1, and then from one of the branches from L2 they unite together to form a genital femoral. So this one is the genital femoral, which one is formed by the union of a branch from L1 and L2. They unite together to form a genital femoral nerve, and this nerve is pierces psoas major muscles, and they run inferiorly the anterior surface of the psoas major muscles run inferiorly. Okay, and then after this one is divided into two branches again, that is femoral and genital branches lateral to the iliac, common iliac artery. Okay, and then after here we can see the L2, L3 and L4 are divided into two divisions, that one is the anterior and posterior division. So first of all I will draw the posterior division of the L2, L3 and L4, through which two main branches of the lumbar plexus is originated. So I will use the another color for the posterior division. So here we can see this one is the posterior division from the L2 and L3 and L4. So they unite together to form a femoral nerve. Here we can see this one is the femoral nerve, which one is the emerge lateral border of the emerge from the lateral border of the psoas major muscles and to form a femoral nerve, and this one is passed to the deep inguinal ligament or iliopubic tract. Then after from posterior division of a L2 and L3, the another branch is originated. Here we can see the another branch is originated from L2 and L3. They unite together to form a lateral cutaneous, which one is emerged from the lateral border of the psoas major lateral to the femoral nerve, and it's also passed through the laterally in inguinal ligament or iliopubic tract. Now I am just going to draw the anterior division of a L2, L3 and L4. So here we can see this one is the anterior division from the L2, L3 and L4. They are unite together to form a obturator nerve, which one is emerged from the medial border of the psoas major muscles and pass in lesser pelvic inferior to the superior pubic ramus or in through the obturator foramina. And in some peoples, not in all, the one branches from the L3 and L4 unite together to form a accessory obturator nerve. So almost like 10 to 14% peoples have a accessory obturator nerve, but not present in all peoples. It also originated from the medial border of the psoas major muscles and even anterior to the obturator nerve. So even dissection we can see the these major branches of the lumbar plexus in relation to the psoas major muscles. So let's try to, or let's write the name of the all branches. So we already write the here iliohypogastric and ilioinguinal. Here we can see this one is the lateral cutaneous. Here we can see the femoral nerve, which one is also originated from the posterior border of L2, L3 and L4. Here we can see this one is the genital femoral, which one is originated from the union of a anterior rami of L1 and L2. And then after here we can see this one is the accessory obturator nerve, which one is originated from the anterior division of a L3 and L4. Here we can see this one is the obturator nerve, which one is the originated from the union of a anterior division from a L2, L3 and L4. So these all are the main branches of the lumbar plexus nerve. We are not including accessory obturator nerve in as a main branches of lumbar plexus because it's not a present in all individual or in all persons. So these all main branches we can also memorize or remember through the mnemonics. So now I am just going to write the mnemonics. So there are three, I will tell you three mnemonics, or so this one is the first mnemonics. We can, which one is the most popular mnemonics? I2 golf. So here we can see the 6 branches. I2 stand for the iliohypogastric and ilioinguinal, G stand for the genitofemoral, O stand for the obturator nerve, L stand for the lateral cutaneous nerve, and F stand for the femoral nerve. Here we can see also, if you wanna try this one, I twice got a lunch on Friday. So I twice means like iliohypogastric and ilioinguinal, G stand for genitofemoral, L stand for lateral cutaneous, or we can also call sometime like femoral cutaneous nerve, O stand for like obturator nerve, and then F stand for the femoral nerve. Here we can also remember through another mnemonics, that is Ilia 2 or second Ilia, or Ilia 2 we can memorize through this way, Ilia 2 give off from life. So here Ilia 2 means iliohypogastric and ilioinguinal, G stand for here genitofemoral, O stand for obturator, and F stand for femoral, L stand for lateral cutaneous nerve, which one is also called femoral cutaneous nerve. So through these three mnemonics we can remember the main branches of the lumbar plexus. So here we can also going to use one of the formula through which we can remember the, or how many branches are originated from a union of how many root of the lumbar spine. So I am going to write the formula, that is 2 from 1, 2 from 2, and 2 from 3. So here we can see 2 nerve from 1 root, 2 nerve from 2 roots, and 2 nerve from 3 roots. So what's the meaning of it? We can see here 2 nerve like iliohypogastric and ilioinguinal originated from only one lumbar spine or anterior rami of the lumbar spine, which one is the L1. And here we can see the 2 nerves or main branches of the lumbar plexus is originated from the union of a 2 lumbar spine or root of the lumbar spine, which one is the genitofemoral, which one is formed from the L1 and L2, and the another one is the lateral cutaneous, which one is formed from the union of a posterior division of a L2 and L3. And here we can see 2 from 3, so 2 nerve is also originated from union of a 3 lumbar spine. So what are they? Obturator nerve and femoral nerve, which are originated from the L2, L3 and L4. So through this formula we can remember like how many branches of the lumbar plexus are originated from the union of how many lumbar spine. So these all are the lumbar plexus branches, and these all are the mnemonics through which we can memorize the main branches of the lumbar plexus. So let's start to discuss about the course of distributions and then after supply of the these nerves. So in this video we will just discuss shortly the course of distribution and the supply of the this nerve. So let's start from the iliohypogastric and ilioinguinal. So iliohypogastric and ilioinguinal is generally enter into the abdomen posterior to the medial arcuate ligament, and then after is pass inferior laterally anterior to the quadratus lumborum and run superior parallel to the iliocrest and pierces transverse abdominal near to the anterior superior iliac spine, and then after then supplied to the abdominal muscle and skin of the inguinal and pubic regions. So it has a two branches, that is motor and sensory. Sensory one is supplied to the skin, and then motor is supplied to the muscles or abdominal muscles. And then after we will talk about the lateral cutaneous nerve, which one is emerged from the lateral border of the psoas major muscles, and then after, or we can also say this one is the emerged from a lateral border of the psoas major muscle lateral to the femoral nerve, and then after pass through the laterally in the inguinal ligament and iliopubic tract, and then after is supplied to the anterior lateral aspect of the thigh. And then after here we can see the femoral nerve. Femoral nerve is originated from the L2, L3 and L4 and emerge from the lateral border of the psoas major muscles and run inferiorly or lateral inferiorly, and then after here we can see is pass into the deep inguinal ligament and iliopubic tract and supplied to the anterior thigh, which one is the sensory root, and then after here is also supplied to the iliacus or innervate to the iliacus, flexor of the hip muscles and extensor of the knee muscles. So it has also two type of the branch, which one is the sensory and motor. Motor is supplied to the muscles, and then sensory is to skin. And then after we will talk about the genital femoral. So genital femoral is generally supplied to the skin of the anterior scrotum area in male and mons pubic in the female, and then motor nerve is supplied to the cremasteric muscles, and then after here we can see it's also supplied the upper segment of the anterior aspect of the thigh in both male and female. Here we can see the obturator nerve. Obturator nerve is generally emerged from the medial border of the psoas major muscles, and it passes into the lesser pelvic inferior to the superior pubic ramus, and then after is supplied to the adductor muscles of the hip, and then after medial aspect of the thigh. It has also two branches, that is two type of the nerve, which one is the sensory and motor. Here and here we can see accessory obturator nerve, which one is pass through superior to the superior pubic ramus, and we can see here all major branches has a two type of the nerve fiber, that is motor and sensory, but lateral cutaneous has only the sensory. It means like it is the pure sensory type of the nerve. So we already discussed about the major branches of the lumbar plexus and the course of distribution, and shortly we also discuss about the innervation. Or so at the last we can see here I am going to draw the lumbosacral trunk, which one is the originated from L5. So it receives some fiber from the L4 and unite with the ant.rami of the L5 and to form a sacral trunk. Which one is the later take part in the formation of the sacral plexus? Which one is the formed by the union of a S1, S2, S3 and S4 anterior rami. So this one is the lumbosacral trunk, which one is originated from the union of a anterior rami of a L4 and L5, and later it take part in the formation of a sacral plexus, which one is formed by the union of a anterior rami of S1, S2, S3 and S4. And then after I also want to mention the supply of the subcostal nerve, which one is pyramidalis muscles, and then after transverse abdominis and rectus abdominis. So subcostal muscles are supplied these muscles. Okay, and then after some time, when our peoples wear like tight pants and then tight clothings, and then after the tingling, numbness and burning pain is feel in the outer thigh, so we call Meralgia, paresthetica, which one is occurred by the compression of a lateral cutaneous nerve of the thigh. So here we can see also, if the surgery like appendectomy or hysterectomy is performed, or like a inguinal hernia is repaired, so most probably to injure the most probable chance to injure iliohypogastric and ilioinguinal nerve. And even we can check the function of the genital femoral nerve through the cremasteric reflex. So at last, I hope this video will helpful for you, and thank you for watching.